Welcome back. You're still watching The Globe. Just before the break, we were describing this surge of COVID-19 numbers in Gauteng. 8,000 reported in the last 24 hours, and that's of the 11,535 cases that have been recorded nationally. So the bulk of it, more than 70%, coming through Gauteng. Well, to tell us a little bit more, we're now joined by the Chief Director of District Services for the Gauteng Health Department, Meisie Lerutla. Thank you so much indeed for joining us, and welcome to the program.
Good evening, Peter, and thanks for having us in this program.
All right, so how is the Gauteng Health Department dealing with this surge that's really taken off this week?
Peter, as Gauteng Health, we have ensured that we have a resurgence plan in place that we are now implementing to respond to these increasing numbers that you have seen. We have ensured that we have activated our teams that are doing the screening and testing in the hotspot areas that have been identified. We have ensured that we continue with the education of our communities on adherence to safety measures. Simple measures, really, the washing of hands, putting on a mask and trying to avoid to be in crowded areas, and ensuring that we are always in open areas or open the windows if we happen to be indoors. And of course, the most important thing, as we are promoting those safety measures, we are also promoting the issue of vaccination, because we all know that vaccination for COVID is saving lives, like all other vaccinations have done. And I think it's important to just indicate that we are extremely worried about the increasing numbers. And really, the most important message that we want to take across to our communities is the control, the limiting of the spread of this pandemic is dependent on us as individuals to just adhere to those safety measures so that we do not continue to spread this virus.
We were speaking to somebody who's with Itemba Labs this week, and he was saying that this is the highest or the quickest surge that they've seen since the beginning of the pandemic. Are you prepared for that in terms of hospital beds and staff on hand?
Indeed, Peter, I would like to agree to that statement that this particular time we're seeing numbers increasing dramatically high. I mean, just between yesterday and today, you have seen on the states that as Gauteng alone, we've had additional 2,000 added to the over 6,000 that we had just yesterday. And yes, to answer your question, we are very ready. Just from the public sector, we have over 4,000 beds. It's actually 4,407 COVID dedicated beds. And of course, we know that we also have beds in the private sector, which also are assisting in terms of the response. But the important message out there that we want to give out is over and above these number of beds that we have dedicated up to now, we do have the capacity to expand beyond the number that we have if the demand increases beyond the numbers that have been dedicated. And Peter, in terms of staffing, it's important to just indicate that in Gauteng, over 8,000 additional posts were created specifically for responding to the COVID pandemic. So yes, the answer is we do have the necessary resources in place. However, we are pleading to our communities not to stretch those resources beyond what is available, and we can do that by adhering to the safety measures that we're talking about and limit the numbers that are confirmed on a daily basis.
The areas of concern, the hotspots, are they increasing in number? Last week we were talking about Hatfield in Pretoria. How many other areas now have become areas of concern?
Peter, we do have areas that we are concerned of, not just in Pretoria. Yes, as we are aware, the increase with the numbers started in Pretoria, and what we call Tshwane Subdistrict 3, that has been the area that throughout, even as we were in the middle of the third wave, that particular sub-district has continued to have very high numbers. And now, as we speak, the numbers have increased even in Johannesburg. Tshwane, for quite some time since the numbers started to increase, it was accounting for over 60% of the total cases in Gauteng. But now, as we speak, even Johannesburg numbers have increased, and actually yesterday and today, the Johannesburg numbers are now exceeding those in Tshwane, and the areas that are mostly affected, our inner city areas, our region E, that's where we're having challenges, region F, that's where we're having the highest numbers, whilst in Tshwane, it's sub-district 3, sub-district 1, and sub-district 4.
Are these areas where there's a high concentration of people living in a smaller geographical area?
Actually, if we look at the situation in Tshwane, the numbers, when they started to increase, the biggest problem was in our higher learning institutions, and we also had a challenge in the SABC base. That's where we started to have these cluster infections. But when we look at the actual numbers, it's not really, we cannot say it's people that are living like in shacks, etc., because we're having them in the suburban areas. So it's not really, we cannot attribute this to the fact that people are just in small areas. I think in small houses, it's more about who the people are exposed to. That is why the issue of trying to avoid to be in crowds and really doing what we can away from other people as much as possible, that is the best way of keeping ourselves safe.
All right, so essentially what you're saying is that it is spreading throughout Gauteng at this stage. It is.
That is the reality. In terms of the numbers, we're having the highest at the moment in Johannesburg, followed by Tshwane, and Ekurhuleni is also coming behind. I mean, if we look at the figures now, I think Johannesburg figures and Tshwane, they are taking the majority of the cases, with Ekurhuleni having just under 1,000, and Sidibeng and West Rand have the least numbers.
Are people coming forward for testing? Is that number increasing, or are you only seeing people that are coming with symptoms?
People are being tested even though they don't have symptoms, because part of how we're responding to this pandemic, if somebody tests positive, then we follow up the contacts, and those contacts, we test them to check if they are already infected. And many of those people that we are testing, they really don't have symptoms. And I have to indicate that there are many people that we are finding, even including amongst our staff members, that are testing positive but not showing any symptoms.
When the first lockdown came into being, it was more about slowing down the spread, not so much stopping it, because it was a given it was going to spread, but it was about slowing it down so that we could prepare our hospitals and prepare medical staff and all those kinds of things. What are we doing now? Are we going to see a lockdown, or are we just managing those cases that come in?
Peter, I indicated already that the control of limiting the spread is within ourselves as community members. Hence, we are promoting the message that says let us all play our role to limit the spread of this virus. We have done the necessary preparations. You are correct. In the first wave, there was a lockdown in order to ensure that we're able to do the necessary preparations. We have prepared, but it is not sustainable to say that because we have ensured that there are available resources, then we can be reckless in what we are doing, promoting the spread of the virus. We should not be doing that. And just from myself, I do not think at this stage there hasn't been any talks about ensuring that there's a lockdown. And I think me and you understand the effect that has on the economy of the country. That's not what we need at this time. So we need to play our parts to ensure that we limit the spread so that our economy is not affected.
Chief Director Meisie Lerutla, we're going to leave it there. Thank you very, very much indeed, and we wish you the best in managing and containing this virus in Gauteng. Thank you so much for your time.
Thanks, Peter.